Cancer prevention, so daily exercise. Exercise of any kind. I don't care if it's walking in place. Exercise, walk around the block, yoga, jump rope, any of that kind of thing. We need to move our bodies, okay? Proper diet, reduction of stress. Stress is a #1 component to depleting the immune system. Very important for us to figure out how we minimize our stress level, okay? Improve our immune function, vitamin D, vitamin C, ginseng. Those are things that can help us improve our immune system to keep it strong. As we get older, we may recommend something called Thymucin or thymus extract. Your thymus gland sits in the middle of your chest. As we age, that depletes. That's a primary thing for our immune system. Proper evaluation of viral and bacterial loads. We all walk around with bacteria, viruses, and parasites in our body. If our immune system's strong, we keep them in check. If it's not, they go wild. They go wild, the immune system depletes, cancer cells can develop. There was a study done back in the 1970s that they took breast cancer tumors, looked at them under the microscope. The majority of them were found to be parasitic in nature. Today, the majority of our cancers are viral in nature. We have things called retroviruses. Viruses are now taking on DNA of bacteria. DNA is now taking on RNA of viruses, and it's getting very difficult for us to fight some of these things off. We can thank Monsanto for some of this. We can thank the chemical companies for some of this. There's a lot of blame to go around, but this is what's happening, so it's making it harder for us to fight and kill these things off. Parasite cleansing, I think, is good. I think parasite cleansing should be done like we spring and fall clean our house twice a year, do a parasite cleanse for ourselves. Everybody has parasites. We're not dirty people because we have parasites. Parasites live on a lot of things. We're all mobile people. A lot of people, unfortunately, don't wash their hands when they prepare food. We travel outside of the country. It's very easy to pick something up, not necessarily know you picked it up, come back here and have minimal problems, but not full-blown parasitic problems, but you can still have parasites. Proper nutrition balance. It's good to make sure you have good nutrient balance. There are some tests you can do, blood testing, stool testing, urine testing, to see if you have nutrient imbalances. And then we can concoct supplements to balance your nutrients instead of guessing. Sometimes it doesn't matter. Everybody's magnesium deficient, that's easy. But if somebody's really ill, we need to know how deficient they are. If you're really deficient in a lot of things, you probably have something we call leaky gut. You have malabsorption, you're not absorbing. We need to fix the gut so that you can absorb nutrients from your foods. Okay. Proper hormone balance is always important. Unfortunately, we live about as many years of our life in an estrogen dominant state from roughly the time we're 38 or 40 for the rest of our life till we die, where we lived half our life with proper hormones. So when we're estrogen dominant, even though our estrogen falls, so does our progesterone. Progesterone falls about age 35. Estrogen will stay consistent till about 45 or 50, and then it will start to fall. So we've got quite a few years there where we have a lot of estrogen and not a lot of progesterone. That's when we start seeing some problems with estrogen-driven cancers. Estrogen is not the evil empire. It's the synthetic progestins that we give in our environment that cause breast cancer. Certainly additives of estrogen in our environment, in our foods and our chemicals, those things are not good. They're called xenoestrogens. Those are really bad estrogens for us. And if we don't do a good job with detoxing in our body, we are going to build up those xenoestrogens and we're going to have a lot of problems. So people who's the one drink drunk in this group? You have one drink of wine and you're like, I could fall asleep. Those of us who are like that don't detox very well. We need to make sure we're detoxing properly. If you're the person that says, yeah, if the doctor prescribes two of something for me, I take a half or one, you're somebody who doesn't detox very well. You need to make sure you're detoxing properly because you're going to be the person that's going to have the problem with these xenoestrogens.